it's pretty far and wide. Whether we're talking about education or nutrition programs or housing programs or the processing of immigration, visas, and citizenship, it's a pretty wide shutdown. And one of the most interesting things is that the way that this is often covered is frustrating because it makes it appear as if it's a Washington game, but for most Americans, this is about as real as it gets. And the longer it goes on, it's going to become even more so, and particularly as we begin to push up against the debt limit. And so this is serious, it's painful, it comes on top of the dramatic cuts of sequestration, and it's going to be too much for many people to bear. I just spoke to someone last night who said that she personally knew, she works with in the New York City public schools and works with poor children, and had heard yesterday of mothers with young children, excuse me, who had gone to WIC sites and WIC programs in New York that were out of food. And that's on day 2 of sequestration. And of course, on the first day, 19,000 kids were kicked out of Head Start. And so this is dramatic, it's painful, it's real, it's not a game.
So talk more specifically about who this affects.
So what's interesting is that during the past 10 years, well, actually since the Clinton administration, the way that most government programs have been turned is to help and to encourage work amongst the working poor. And so that's why most people who are poor in this country work and have children. And many of the government programs that are discretionary, under discretionary spending, are designed to help that group. And so that is and the nutrition program of WIC that I spoke about, Head Start, which is what poor parents and particularly working poor parents use to help give their kids an equal footing with everyone else. That is on the back foot. In terms of housing, there are 3 million people in this country that get their housing through housing support, who work but don't earn enough to live, who get housing support through discretionary programs, and Pell Grants, which is a means-tested grant by the federal government that helps students from backgrounds that may not necessarily be wealthy have a chance to go to school, and on and on and on. Those are all of the types of things that are up and on the block right now, and it's frightening. A lot of people are in a tough spot.
Furloughed federal workers handed out shutdown guides to tourists in Washington, D.C. on Wednesday. The guides listed which monuments and museums are open and which are closed during the government shutdown. Seth Koslar, who's worked for the Federal Aviation Administration for the past 25 years, says the furlough will hurt his family.
I actually have 2 kids in college, out-of-state tuition. It's going to be a significant financial hardship. I'm talking about possibly getting emergency loans from the credit union. Just finished paying this semester, but if this goes on 2 to 3 months longer, they won't be able to attend next semester. May have to pull them back. Exactly, and one is getting ready to graduate next year, so he's really kind of calling me every day, asking me when are we going back to work. So he's close to graduating, so that would really be a crushing blow to my family and his future.
Imara Jones.
I mean, it's just one story of millions. One of the other interesting parts of the story is that the federal government is the largest employer in the United States. And regardless of whether or not one is furloughed or at work, you're not receiving a paycheck. That means that 2 million families are not receiving pay because of unionization and anti-discriminatory laws. People of color are overrepresented in government jobs. That's true for the federal government. There are more people of color in the federal workforce as a whole than the broader workforce. And so what this means is that the employment crisis in communities of color, the economic crisis in communities of color is accentuated and exacerbated and extended by this shutdown.
And then you couple this with the healthcare exchanges, who gets covered and who doesn't. The front page of the New York Times today, major piece, millions of poor are left uncovered by health law. Choice by states not to expand Medicaid undercuts reach of Obama plan.
I mean, one of the interesting things is that the GOP is saying that this is about Obamacare and want to shut down the government because of Obamacare. But the GOP largely has defeated Obamacare in a lot of places in the country. And that's because, as the Times point out, as I've written about, as you just said, that...
You've written about it well before this.
I did. I did. That half of the states are in the United States aren't participating in Medicaid. Overwhelmingly, they're in the South, where half of people of color live in this country, black people, and also Latinos. The second largest state in the union that with a Latino population is Texas. It's not included. And so it's leaving a lot of people behind. And so they say that they want to roll back Obamacare, but through stopping Medicaid, they largely already have.
I mean, it really is astounding. The 26 states that have rejected the Medicaid expansion are home to about half of the country's population, writes the New York Times. But about 68% of poor, uninsured blacks and single mothers, about 60% of the country's uninsured working poor are in those states. Among those excluded are about 435,000 cashiers, 341,000 cooks, and 253,000 nurses' aides. Trudy Lieberman, you've also written extensively about the whole, not only the Affordable Care Act, but just who gets covered and who doesn't, because you have to include those who are going to be cut off of Medicaid expansion when they don't get Medicaid expansion in their state.
Right. The irony right now is that the poorest of the poor are going to be left out of this expansion of health care. And it's, as the Times points out, it's affecting a whole lot of people at the very, very bottom of our income and our work spectrum. And these are the people who are usually have incomes below the federal poverty level. They have very erratic work histories, work jobs, and so forth, and they really have no options for getting health insurance. And the Obamacare, the Affordable Care Act, had contemplated that they would be part of this Medicaid expansion. So when the 26 states decided not to expand, there were provisions for people between 100 and 138% of poverty. Arguably, they have low incomes too. But ironically, the people below 100% are not going to get help. And they have no money to buy expensive health insurance. And in most of those states, I think it's worth noting that the Medicaid programs that do exist do not offer benefits to childless adults. And that is especially true in places where they have huge numbers of people in these populations.
And when does the states that have decided against Medicaid expansion, when will people be affected?
They're actually already being affected because they're effectively now not under the insurance tent, and they have probably never been. And so on January 1st, it was contemplated before the Supreme Court ruling last year that they would be brought under it, and they're not going to be.
Imara Jones, you were in the Clinton administration when a previous shutdown happened in New York. I remember the famous image of the New York Post of Newt Gingrich, as a baby having a tantrum because he was very upset that he was put at the back of the Clinton plane. And of course, in the end, they were forced to back off, the Republicans.
That's right. That was actually my very first job, and I had probably been there, I don't know, a couple of weeks. And one of the most interesting things is the degree to which it is incredibly disruptive. It takes maybe, from the shutdown that lasted 3 weeks, it took maybe 8 or 9 months for the federal government to sort of really pull itself together and to stand itself back up after a 3-week shutdown. And this is more dramatic because at that time, half of the government was shut down because they'd passed half of the appropriations bills. This is now the entire government. And who knows what collateral damage we are causing by shutting down the government. For example, the Centers for Disease Control is in the midst of their flu vaccination campaign to vaccinate millions of the most vulnerable to prevent the spread of the flu. Well, one of the interesting things is that because of the government shutdown, that program is now been halted. And as a result, there's a distinct possibility that the longer this goes on, that we won't have vaccinated millions for the flu and maybe setting ourselves up for a flu epidemic. And that's just one. That's just one of the most obvious. And there are countless examples of that.